Okay, welcome. My name is Andrew Holloway. I am a physical therapist and owner of Sea Pines Physical Therapy. This is my first video on YouTube, so I hope that it goes well. The purpose of the video is to recap a talk that I've done at West Seattle Runner here in Seattle, Washington, to a group of runners who are either just starting their running journey or have been running for some time. The title of the talk is Strategies to Prevent Running Related Injuries. Quick disclaimer, since this is going out to the interwebs, I'm a physical therapist. This is general information that's come from my reading of the literature along with my clinical experience. This is not medical advice. It's not meant to diagnose or treat any specific condition. I think that can all be assumed, but I want to be explicit about that. So again, when we look at running related injuries, the unfortunate truth is that they happen. Studies show that about 50% of runners get an injury at some point during each year that they run that prevents them from running for some period of time. I think the marker was about a week. Okay, so if half of runners are dealing with some injury during the year, each year that they run, what can we do to make it so you, the listener of this talk, is in the good half of that, right? The 50% of runners that don't need to take any time off from their chosen activity due to injury. And I want to start this talk by doing a little bit of fact and fiction. I find that as I do these talks and as I talk to my clients in a clinical setting, that there's a lot of misinformation out there, and some of it has been pervaded by the medical community. New research has come out on some things, and so I want to share some of that. We'll use a fun little format of fact or fiction. Then I want to go over kind of the meat and potatoes of my talk, which is that there are factors out there that can help us reduce our risk of injury while it's running, there's three main factors that I'll talk about there. Then I want to go in depth on one of the factors, which is your biomechanical resiliency, to use kind of a big term. But the biggest way to make yourself more robust and hold up to the rigors of your running that you want to do is through strength training. So I've got some specific exercises that I'll advocate for you completing towards the end of this talk. One more thing right at the end, we will talk about what to do if you do have a niggle, an ache or a pain. And so off we go. Let's start with our fact or fiction. First one is running at a higher cadence can decrease the impact force on the legs. So let me unpack that a little bit. Cadence is the number of steps that one takes in a minute of running. Some runners take a lot of steps. They have a short and quick stride. Some runners take fewer steps. They have a long and slower stride. And this is one of the things that we look at in terms of impact forces. So does running at a higher cadence in fact decrease the amount of wear and tear or impact through your joints? And the answer to that is fact, is that running at a higher cadence, anything in the neighborhood of 170, 180, even 190 steps per minute has been shown to decrease the amount of forces going through the knee and hip while it's running. That's a good thing. Running is by nature a fairly high impact sport, so anything that we can do to mitigate the impact of running, we will do. So we'll talk about a bit about cadence during this talk. Second one is runners that strength train typically gain weight. And so we kind of think about that. You're lifting weights, does that lead to weight gain? And according to research in 2017 by Beatty, I'll link to that in the show notes here. In fact, I'll link to the entire talk here. Found that runners that perform strength training don't in fact gain weight. they may change how they're holding their weight. They may have a bit more muscle, maybe some less fat. But that's often a concern that I hear from runners, is that, oh, I don't want to lift weights. I'll get heavier, I'll get slower, there'll be more to carry around while I run. And that's fortunately not found to be the case. Talk to, my kind of aside on this one is, talk to people that are trying to put weight on through strength training. It's tough. It can happen. It does happen with consistency, but it's not like, you start lifting weights and wake up one morning and you say, oh no, where'd all this muscle come from? So let's go to number 3. Strength training makes runners more efficient. So that is another true one. So strength training does in fact make one's running form more efficient. So we find that in runners that participate in a strength program and then they go and run, they're actually using less energy to complete their runs. Same distance, same speed, they're using less energy. And we think that's because the body becomes a bit more efficient through strength training. That's mostly through the nervous system. The brain and the peripheral nerves get better at activating muscle fibers. We can spread the work of running out amongst more muscle fibers that we're now better at contracting or using. And so that leads to increased efficiency. So that's great. You're going to be spending less energy to run at the same speed, or you can run faster with the same amount of energy. Great. Let's go to number 4 of 5. This will be a controversial one. Stretching has been shown to help prevent injuries for runners. And that one's false. We have no good studies that I've found that show that any type of a stretching program leads to a decrease in injury. Whereas we've got lots and lots of studies to show that strength training decreases the incidence of injury with runners. So that leads us to ask, what is the role of stretching for the runner? And I think it's case by case. I think potential benefits of stretching are relaxation, kind of a mental switch. It's helpful to do stretching after running, not before, but after, to kind of transition from that more strenuous activity to a more sedentary activity. So kind of a cool down. If someone has an especially tight muscle group, it may help if done consistently and at least for 6 weeks with long hold stretches. It may help lengthen a certain muscle or at least decrease the tone at that muscle. But it hasn't been shown to, say, prevent injuries like, Achilles tendonitis or hamstring tendonitis. So do it if you like. If you find benefit from it, I'm not going to say don't do it. But I do want to dispel that myth that one of the things that I hear from a lot of runners is, oh, I got hurt. I think it's because I'm too tight. We now know, we've told people that in the past, don't get me wrong, PTs have probably told people that for decades, and maybe some PTs still are telling people that, but there's no good evidence to show that is in fact the case. So injury risk, again, is more associated with the 3 things that I'm going to go over now, and again, a big way that you can mitigate this first one that I'm going to talk about is by doing strength training. So 3 factors that do, in fact, research shows influence one's risk of getting hurt while it's running. First one is your biomechanics, okay? And I'm going to lump into that first category one's running form. So it's not only what can you do, what is your strength, coordination, range of motion, but then how do you use that while it's running? So that's big category number 1. Category number 2 is your footwear and your surface. I'll add to that. What are you running on? Are you a trail runner? Are you a track runner? Are you using a minimalist footwear? We'll talk about that a little bit. And then the last one, and probably the most important, aside from strength training, is your training plan. So are you on a training plan? Do you have some organization and some thought and some structure around it? So let's talk about biomechanics to start, and I'll start briefly by talking about running form. We talked about it on our first section here about cadence. That's the number one thing to think about with running form, in my opinion. You'll find sports medicine folks on different ends of the spectrum that some might focus more on cadence, some might focus less on it. I find that with my runners, fairly unilaterally, if they are showing a lower cadence, that by increasing it, we find that most of the factors, in terms of the biomechanics of their form, meaning their joint angles while it's running, come towards midline. An example of that would be heel strike versus toe strike. So we find that folks that typically have a longer stride are more likely to be heel strikers. So the first thing to hit the ground as the foot's coming down is the heel, with the toes in an up position. Okay, that increases the joint reaction force all the way up through the kinetic chain, and might put one at higher risk of injury. Okay, so now we take this runner and we tell them, okay, don't worry about what your foot's doing. I'm not going to tell you to become a toe striker or anything. I'm just going to ask you to, instead of run at 160 steps per minute, I'm going to use my phone and set a metronome to 180 beats per minute, and I want you to match that with your stride. So beep, 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 and every time it beeps, one or the other foot needs to be on the treadmill. So now we've increased the cadence. If we're on a treadmill, we're at the same speed, which is great. And so now we've decreased our stride length. All right, full circle. We decrease our stride length. Instead of the foot out in front with a big heel strike, now the initial contact, where the foot hits the ground for the first instant during the running gait, is more underneath the client, is more underneath the person's hip, and the foot is a little flatter. So we've taken away that big heel strike. We've decreased the amount of initial impact force with the running gait. Okay, so that's cadence. What's my Reader's Digest recommendation on that is to have an idea, a number for what your desired cadence is. That's pretty easy. Just run for 30 seconds, see how many foot strikes you had, count how many foot strikes you had, and then times that by 2, and that's going to give you your steps per minute, right? And again, I advocate, really regardless of speed, for something in the 165 to 190. So a few exceptions. If you're really at a slow speed, maybe a 14-minute mile or so, then you may be a little lower than that. But really, a good study. Sorry, I'm going to grab a little coffee here. A good study looked at high-level runners and looked at their cadence. And of course, high-level runners don't run fast all the time. They have slow training runs. They've got fast runs. They've got interval and tempo and all these things. And they found that even on these elite runners, their training runs, their long, slow runs, speed-wise, they still kept a fairly brisk cadence. So they were still up above 180. So that tells me that, even us mere mortals that like to go a little slower with their running, or are able to go a little slower like me, are still able to and probably preferably should do a fairly high cadence. All right, that's cadence. If you're finding that your toes are pointing out, pointing in, while you're running consistently, and that you seem to be kind of having trouble with running due to toes way out or toes way in, you want to kind of think about pushing things straight along. An image I like for that is like railroad tracks. Imagine that your kneecaps are running right down railroad tracks. That can help. Another cue I'll use for some folks, and these are obviously different people's strides need different things, right? So these are just some ideas if you're struggling with something specific that you can maybe try on as a cue. One would be to stay tall through your trunk. You want to be hinged or leaning forward a bit from the hips, but you want to stay tall with the chest. And then the last thing is to kind of think about being soft or more mobile through the ankles, knees, or even the feet. Sometimes I see some people get pretty stiff when they run. So that's kind of the stride piece of it. The other biomechanical part of it is what we'll talk about at the end, is the strength training. So strength training helps not only the muscles, which we know, hopefully, it helps the joints, the bones, and the connective tissue. So when we think about running, such a high impact activity, having higher bone density through strength training will certainly help with bone related stress injuries. Having better joint integrity, so the white stuff, the capsules of the joints, the tendons, and the ligaments, those are all strengthened through doing strength training. So your biomechanical resiliency to injuries will definitely go up with your strength training. Let's keep trucking. Let's talk about footwear a little bit. So another hot topic, right? You will find, a shoe that will tell you, or a shoe company that will profess that their shoe is the best for everybody, no matter what. And that's just not the case. So let me try to take a little bit of an evidence-based approach to footwear. Broadly, running shoes fall into three categories. There's like a motion control shoe, right? So that would be on the highest end of things. Think of shoes like the Brooks Beast. This is a shoe that is, as the name implies, meant to change what your foot does while you're running. So rather than what we typically see with a foot that needs a motion control shoe is that it's overpronating, okay? So foot hits the ground, it flattens, and even turns in before pushing out. So that's a motion control shoe. There's a stability shoe, which has some structure to prevent overpronation or overtly kind of collapsing inward at the foot. There's a neutral shoe, which is meant to just keep the foot doing what it's doing. And then there's a minimalist shoe, way on the end. That is a shoe that has little to no cushioning, has little to no stack height, and the difference between a neutral shoe and a minimalist shoe, or minimalist shoe and really any other running shoe, is that cushioning, okay? So there's pros and cons to having a higher or lower stack height. I'll kind of lay my cards on the table. The research shows pretty clearly that folks that use minimalist shoes for running, at least for the first 6 months of using a minimalist shoe, have a much higher risk of having an injury, whether it's a bone stress injury or any other injury. Way higher risk of injury for the first 6 months. After that, I don't know how good of data we have, right? So if it were me and I got a stress fracture in my foot while wearing a minimalist shoe, I would probably change to a different shoe, right? So we don't have good long-term studies that I know of on minimalist shoe wear. The purpose, of course, of a minimalist shoe is to strengthen the idea, or the theory is to strengthen the muscles on the bottom of the foot. I think that's a worthy cause, and in fact, I'll advocate for doing some we call it intrinsic foot strengthening. I think that if one is committed to using a minimalist shoe, a wise thing to do is to increase your running volume very slowly, do strength training, and watch your surface. So the surface with which you're running on matters tremendously with a minimalist shoe. Concrete is something like 1,000 times stiffer than dirt. So the argument about minimalist shoe being more natural is great, but if we look at human history past, we haven't been running on concrete for very long. So that's where that cushioning comes in. What's the downside to a really high cushioned shoe, right? Like something with a very high stack height. Thinking about Hoka's and many other shoes now. Downsides to that are that some people will actually decrease their cadence when using a higher cushion shoe. So that's something to be aware of. If you're using a cushion shoe with a high stack height, you need to be cognizant of your cadence. The other downside to a really high cushion shoe is that it does require good integrity through the foot and ankle. Think of it a little bit like a trampoline, right? If you are jumping straight up and down on a trampoline, everything's cool. If you're jumping to the side, or off at an angle on a trampoline, then it projects you off that angle, right? So same thing with the foot, right? If when your foot hits the ground and you're way up on a cloud-like shoe and it's angled, now we've got this trampoline effect that might make you go further off center. So those are some general considerations with shoes. I haven't talked much about the evidence around footwear. I guess the best thing that I'll say is that, or my summation of the evidence is that number one, looking at foot posture does not necessarily tell us what shoe one should be wearing. And number two, feel is important. So not helpful, sorry, but my best advice is to go to a high quality running store. Again, we're here in Seattle, and in West Seattle, we have West Seattle Runner, thankfully, who employ seasoned runners who are trained well on assessing gait, assessing running, and finding the right shoe for you. Any changes in footwear should be taken slow, and footwear runs out, meaning footwear has a shelf life of about 300 miles, give or take. Of course, that depends on running surface, running speed, body weight. Are you also wearing them while you're, hedge training or whatever it is? So look at your shoes, make sure that they're not excessively worn, and a couple of tests for footwear would be to, if you take the shoe and you can fold it and it starts to look like a banana, it's probably not doing what it needs to for you. It should look more like a hockey stick, or have a little bit of a bend to it through the forefoot. And then the second test is if you can twist it. When you twist the shoe and kind of twist easily like a sponge, then it's probably not giving you enough stability torsionally. There needs to be some give there, but just a little bit. So you notice that if you've got an old pair of shoes around, test that against your new shoe and see if there's a difference there. Trying to think if there's anything else I would say on footwear. You should like your shoes. They should be comfortable for you. So there's that. Great, let's talk about training plan to finish on this first section. So the folks here at West Seattle Runner are on, programs, either Get Fit or Got Fit, or I don't know what the third one is, like elite level fitness. And study after study shows that having a plan and sticking to that plan so that you can kind of control the volume of stress through your body and load it appropriately is the most important thing. We see a lot of what we call too much too soon injuries, where someone gets excited about running and says, okay, I'm going to run as far as I can until I'm exhausted, and then I'm going to do it the next day and the next day, right? And running's a stressful thing for your body. That's a good thing. All exercise is stress for the body. So it requires rest in order for your body to recover from that stress and then adapt. And the adaptation, of course, is what we're after, right? We want the adaptation so that our heart and lungs are more efficient, our muscles are stronger, our bones are stronger, connective tissue is stronger, all of those great things. That takes time. And so if you are on a training plan and you are tempted to accelerate it, word of caution, take it slow, especially with running. if you have extra energy during the week and you want to invest more in your cardiovascular fitness, I would advise finding a low impact form of cardio, swimming, cycling, of course elliptical, rowing. I'm sure there's others that aren't coming to mind, but those are great. Walking, of course. Our goal should be to do at least 30 minutes of continuous exercise each day. And for some days that's going to be your running, and for other days that needs to be, a walk with the dog, dancing in your house, cleaning the kitchen, swimming, whatever. But it shouldn't all come from running, right? Okay, so stick to a training plan and watch all those little variables. Frequency, how often are you running? Duration, how long are your runs? Pace, if you have a desired pace, are you able to stick to it? And then lastly, your running surface. Are you at a point where you're just starting to run? Maybe you want to stick more to tracks, running tracks. Are you a more seasoned runner that's done lots of trail running? Look at the technical level of the trail that you're on. Make sure that that's in line with what you're trying to do in an organized fashion. I'll say one more thing. Sidewalks, at least here in Seattle, are pretty dicey. So I've had a number of clients fall, and athletic people fall and hurt themselves on sidewalks, especially this time of year when it's dark. So use lots of lights, illuminate yourself, get your headlamp on and all that stuff. Scan, if you're running in the dark, do scan your surface, because cracks, bumps, those type of things can sneak up on you. So great. Let's move on and let's try to cap this thing with talking about strength training, and then a few more maybe pearls on what to do if you do have an ache or pain that's limiting you with your running. Strength training. So I've already talked a bit about the benefits of it, efficiency, injury prevention. Great. In terms of specifics, I will link a exercise program that I use through MedBridge. We'll go ahead and link that in the description of this talk in YouTube. Let's talk about kind of the mechanics of it first. So what's a good frequency with strength training, and when should one do it? Most people that run are going to run between 3 and 5 times a week, right? Some people are going to be 2, some people are going to be 6, but in general, most people are 3, 4, or 5 times a week. I advocate for strength training twice a week, at least during certainly an off season and a build. If you're peaking, meaning you're real close to your event, I advocate for going down to 1 time a week. And if you're tapering, meaning you are 1 or 2 weeks out from your event, I advocate for cutting the strength training out temporarily. So 2-1-0 type of a thing on frequency. 2 for most of the year. 1 if your training load's really going up on your running, or you're really getting close to your event and you want to taper down to 1, that's fine. And then 0 right before your event, 1 to 2 weeks before. And then structure, so sets, that's a number of repetitions, right? So I advocate for around 2 sets of 15. Is 3 sets of 15 a little bit better? Yes. Is 1 set of 15 a little worse? Yes. So 2 seems to be the happy kind of medium for most folks. In terms of the exercises themselves, and these can all be done at home with just a little bit of equipment. The first one, and again I'll link to these so that you can see videos of them, is a side plank with hip abduction. So you can start with kneeling side plank, so you're on your side, on your elbow, come up so your hips are off the ground with the knee down, and then with the top leg be doing leg lifts. It's an excellent exercise for the glute med, which is a super important muscle for stabilizing the pelvis over the leg. So that hip abduction strength is an independent variable for injury risk. So that means that literally, that's one of the things that we know we can positively affect and decrease one's risk of injury. So glute med strengthening is key. The second one I'll say is calf strengthening. So calves are super important for propulsion during the running gait, and doing strengthening of the calf is really, think of it as strengthening for the Achilles. We've all, it's called the Achilles tendon for a reason. So we do want to try to steer clear of Achilles tendonitis as well as plantar fasciitis and these things. And one of the best ways to do that is through having a strong calf that you're using well during your running. I advocate for an elongated calf raise, meaning using a box or a step, dropping your heel off of that step and then driving up, slowly dropping off, driving up. If you can, you start with double leg. If you can, you start with single leg. Going from there. So that's number 2. We just got 2 more. We got intrinsic foot strengthening. That is literally just tensing the muscles on the bottom of the foot. I think that this helps with coordination as well as intrinsic, foot strength. This is to, again, help prevent overpronation and try to prevent plantar fasciitis. Think about, this is a tough one to do. Again, my hand is a foot, sorry for the imperfect model here. What you want to think about is the top of the dome of the foot raising up. Okay, so you're contracting the muscles on the bottom of the foot, raise the dome up, let it splay out, raise up, let it splay out. Lastly, let's talk about abdominal strength. My favorite, ab exercise, because it's easy to teach and fairly easy to keep the right form on, is the front plank. EMG studies, where we look at the electrical activity on abdominal muscles, consistently show that front planks are excellent for activating the abdominal muscles. So good old front plank. I prefer off the elbows. My cue for it is to pull the shoulder blades down, pull the sternum, the breastbone, towards the pelvis. So now we're kind of contracting the lats on the back side and the abs on the front side. That, of course, isn't for reps. That's more of a hold. I'd say doing 2 sets of up to 60 seconds on a front plank would be my preference there. Strength training is, as of recording of this video in early 2025, continuing to explode in popularity. So hopefully none of this information is super new to you, although if it is, great, now you know. Many runners are aware of the need for strength training and do strength training in a more formal setting at a gym or even at their house with weight. Heavy compound lifts are excellent for runners in general. So things like squat, deadlift, if done with excellent form. Those sort of things can be really helpful. So also on the strength training front, some people are really good about strength training by themselves. Other people require a little bit more support. Of course, you can enlist the help of a personal trainer. My advice would be to work with a personal trainer that's more on the running coach end of things. So feel free to get in touch with me if you're looking for help with that. I am not, I will refer you to someone. I am not a running coach myself. So there's that. However, if you are interested in more of a group setting, I do small group strength and conditioning work here in West Seattle, and that is a kind of a cyclical program. We do 2 times a week for 6 weeks. We take a few weeks off. People go work on their own on some of this stuff, and then we meet again if it makes sense for people. So I offer that 3 to 4 times a year for 6-week chunks, and I do a lot of teaching with that because I want people to eventually be able to do this stuff on their own, though there's great benefits to a group setting as well. So you can get in touch with me. It's just hello@cpinespt.com if you'd like to join into some small group training. Great, let's finish up by talking about what you should do if you are running and you have a little bit of an ache or a pain. I think the first thing to do is breathe. Remember that your body is robust and resilient, and that you probably you'll know if something's completely ruptured or broken, right? So try to, I'm speaking to myself here too. Try not to catastrophize with when you are having an ache or a pain. Realize that most aches and pains that don't have like a dramatic onset. Most things like overuse injuries get better on their own in a week or two. If you haven't started seeing progress in the ache or a pain in 10 days to 2 weeks, that's maybe time to start enlisting the help of another person. If you are having an ache or a pain that is persistent, meaning, okay, I'll just use an example. My hip flexor started hurting during a run, felt okay afterwards, but then when I woke up the next morning, it was sore all the next day. Think of those types of aches and pains as kind of warning shots, right? Saying, all right, that muscle's had enough work recently, let's give it a little extra rest. So of course the strategy would be to abstain from the aggravating activity until at least you started to see some progress with it. And that should take, again, no more than 10 days or so. So yeah, abstain from running until you're feeling fully recovered. And if you're having any sharp pain, anything above a 6 out of 10, obviously if you're having anything that is really changing the way you walk, or where you're yourself concerned, get in touch with a medical professional straight away. In terms of who to see if you're having an ache or a pain, of course, this is, widely variable on where you are in your state and your practice act and all of those things and your access to care. Know that in the state of Washington, physical therapists practice under what's called direct access. Sorry, my dog's here is growling at me. Maybe she didn't like me saying that. So you are able to see a physical therapist directly if you're having something that you feel is an orthopedic issue that would benefit from conservative care that PTs provide. I want to be clear, always err on the side of getting more help than less help. If you have a problem that you're not sure about, best to reach out and take appropriate action. Great. If you want help specifically with a running-related injury, if you want help designing a strength program for yourself for running, if you want to get in touch about small group training regarding running, I'm pretty easy to find. The name of my practice, again, is C. Pines Physical Therapy. Our website is cpinespt.com. I think that's where I will wrap up for today. Feel free to get in touch with me via email at any point. I hope that you enjoyed this video. Again, my first attempt at streaming something here or putting it up online, so obviously it wasn't perfect, but I enjoyed it. And reach out if you have any questions, or feel free to leave a comment on this as well. All right, hope that you're well and happy running.